Welcome to the Lifestyle Herbalist, the podcast where holistic wellness meets everyday living. I'm your host, Dabney-BS, registered dental hygienist, clinical herbalist, and certified health coach.
And I'm your co-host, Sabrina Cooper, a registered dental hygienist with a bachelor's in oral health promotion, a certified culinary nutritionist and herbalist, and a mindfulness and mindful eating coach. Together, we explore the intersection of holistic health, herbal wisdom, and joyful living. From plant-powered remedies to kitchen medicine, mindful moments, and conversations that feed the soul, we're here to help you feel vibrant, grounded, and inspired in your daily life. So steep a cup of something soothing, settle in, and let's grow well together one episode at a time, bringing you a healthy dose of happiness. Today we are joined by Beth Woodcock, a seasoned manual therapist whose hands-on healing journey spans nearly 3 decades. Beth began her career as a registered massage therapist back in 1995, dedicating over 25 years to therapeutic bodywork before expanding her expertise into the field of osteopathy. Since 2010, she's been practicing as an osteopathic manual practitioner after graduating from the Canadian College of Osteopathy in Toronto. A proud member of the Ontario Association of Osteopathic Manual Practitioners, Beth has continuously deepened her practice through extensive postgraduate education. Before relocating to beautiful Fenelon Falls, her clinic in the Durham region was recognized with back-to-back Reader's Choice Awards for Best Osteopathic Clinic, a testament to the trust and care she inspires in her clients. Stay with us as we explore Beth's approach to healing, the philosophy of osteopathy, and the powerful ways the body tells its story if we know how to listen. Hi, everyone. We're excited to have Beth here with us and talking a little bit about osteopathy and what it is. And I know a lot of people that I speak to, and that word comes up, they're like, a what? Apathy? And then they don't have any clue. So we thought this would be a great opportunity to talk to Beth and have her tell us a little bit about her career and where it's led and how she's gotten to become this wonderful osteopath in the area of Fenelon Falls. So welcome, Beth.
Thank you. Hello, everybody.
Hi.
Hi.
So Beth, tell us a little bit about what your journey to becoming an osteopath. What led to osteopath?
Basically, I started in IT, out of university in IT, and then I didn't like sitting in front of a desk, so I became a massage therapist. But I knew right away I wasn't. It just didn't go deeply enough for me. I didn't feel I could help people in the way that I wanted to. So I went into osteopathy and in Canada, Ontario. And it was a 5-year part-time course we could work. Like it was 1 week a month for 5 years, and then a thesis at the end of that, which they gave you 3 years to do the thesis. And it was a journey. It was tough, but I thoroughly enjoyed it. So that was my journey.
Great. And go ahead, Dabney.
Oh, I was just going to say, so being in the United States, that's not something that we're as familiar with. Your career with the manual osteopathic career. So tell us how that's different from like other modalities that are similar yet different.
So osteopathy in Canada is very different than osteopathy in the States. For one thing, because in the States, you get your osteopathy degree concurrently with a medical degree. So they are medical doctors in the States. Up here, when I went to school, you had to have a university degree to get into the program. And it was helpful to be a clinician previous. And every country has different requirements. Most countries, it is a separate degree from their medical degree. But in Canada, it's just getting into the college level. It was a private schools generally when I went. But to answer your question about how different it is from other modalities, it's, basically it's a manual therapy. We look at the whole body as a unit, and you're really focusing in on optimizing function and structure and neurovascular flow to create the best environment for the body for homeostasis to work, or for self-healing. And so you're very much concerned with posture, alignment, neurovascular flow, and you look for any restrictions.
Mm-hmm.
And we use all the tissues of the body to help release those restrictions, to find ways to release those restrictions. It's very gentle, although you are doing osteoarticular mobility and manipulation, but it's different from a chiropractor's manipulation. It's not a high velocity thrust as a chiropractor does. And you're working, with the different systems of the body as well, the nervous system and the respiratory system. And it's quite in depth.
Mm-hmm. What types of patients tend to call you? What are ailments? What are their complaints that they're needing help with?
I would say most people come in for pain. Whether that be back pain or, shoulder pain is a big one recently. Concussion is another big one. More recently for sure, because a lot of people didn't get treatment for concussions in the past. But mostly it's pain or mobility. So I feel like I'm walking on stones. My feet feel like I'm walking on stones, or just, hip mobility isn't quite right. So those are the two things, pain and mobility.
Mm-hmm.
People who know about osteopathy and have chronic illness will come in for chronic illness, but a lot of people just wouldn't think to seek an osteopath for a digestive issue or a metabolic issue or that kind of thing.
Yeah. Well, it wouldn't have been on my forefront. Like typically when somebody has an ailment like a metabolic issue or a stomach issue, they go see their regular doctor. They typically get a med.
They do.
Everybody crosses their fingers and they go on their merry way. There
Yes,
again,
they do.
we treat symptoms, never really getting to the root of the problem, which I think it sounds like at your wheelhouse is that you look at the whole body, trying to get to the root so that the person can have real healing.
Right. And it is a bit like peeling an onion, because, the body is a compensatory mechanism. You have a fall on your bike when you're 3 and you hurt yourself, and then you have a car accident when you're 20, and these things accumulate in the body.
Absolutely.
And and there's a scale in there keeping track, and all of a sudden you're 50 and you reach for a cup of tea and your back goes out, and then you're seeking attention. But it's like peeling an onion, because you have to those things accumulate in the tissues, and so you might look at one thing and get rid of that, but then another thing appears,
Right.
from a previous trauma. So it's like a puzzle. Everybody's different. Everybody's like a puzzle. Very interesting. It's very stimulating to be an osteopath mentally.
Mm-hmm.
Well, it probably deals with a lot of the mental and like emotional aspects if you're dealing with that as well, because once you start releasing and taking the layers out of the traumas and things like that, you're also going to release all that you've been holding on to, I'm sure, right? So there's that.
You're absolutely looking at the whole, the mind, the body, the spirit, and also um, y- you know, certainly trauma, like if sometimes you'll place somebody in a particular position on a table and they will have an emotional release, and it's because that's how they felt when they had a car accident, or just even putting your hands on somebody, you can tell if they're toxic in their tissues, or if they're a worrier, or if they're it's all because it does, those things do, and stress of course has a huge effect on the body,
Yeah.
as far as illness and disease and mental illness and anxiety, that kind of thing.
Yeah, our whole body is a story. Um,
Our whole
and
body is a
in
story. That's exactly right.
Yeah.
yeah, and in my training as a clinical herbalist, my teacher in our health histories, we would go over intakes with our clients. We would go back to, these traumas, like you said, I fell on my bicycle and hit my head when I was 8. I was in a car accident at 20. And so it's listening to those patterns, and then they come in because they threw their back out, but really it's not, their back out is the symptom of these other greater issues that have been hanging on. So yeah,
Right.
and sometimes we were taught then to go back to that bicycle accident, go back to that car accident, and you treat the person going forward, because many times the thing they're coming in for really isn't the thing they're coming in for. It's really the past experience.
Right. And even physically, people, even though you give them an intake form and you do a health history interview, um, they'll often say, oh, and, by the way, I forgot, I broke my leg 5 years ago, or, something really big.
Hmm.
And,
Yeah.
and they neglected to put that on any of the history. So it's important to have a dialogue throughout the
Absolutely.
treatment,
Yeah.
for sure. Yeah.
It's amazing how many things people won't like tell you, like thinking it's not relevant or
Right.
relatable to the medical history. I mean, we face it a lot in dental. We'll ask if there's any changes to medical history within that, and they won't say about a fall or that they took this medication within this short period of, but it still
Mhm.
can have some, we still should know these little things. And like you said, like it's funny how eventually when you're clean teeth, they're like, oh, by the way, did I tell you that I went to go see my doctor and I had this like 3 months ago? And I was like, I just
Mhm.
asked you 6 months if there's been a change.
Mhm.
So
Mhm.
yeah,
Yeah.
you start
And
working with someone.
for instance, with back pain, it's commonly coming from the front. For instance, a gallbladder surgery or a C-section, scar tissue, and people often won't put down that they've had a C-section or a gallbladder surgery, but those scars can be, very, um, they can do a lot of damage over time to, posture and pulling the body out of its normal line of gravity.
Yeah, certainly as dental
Mhm.
hygienists, we have typically lots of musculoskeletal issues, and many hygienists sadly retire early because
Yeah.
of musculoskeletal issues, because we are in a leaning forward position during our clinic time. And so I'm always
Also
kind to
tense.
trying to remember to like shoulder blades together, just so I can try and like right up the ship. But still, at the end of the day, like I had a massage on Friday, and the massage therapist like pushed down on my shoulders. I was like, oh, that's tight. And I was
Mhm.
laying on my back and she pushed down on both sides. It's like, oh yeah, that whole muscle across my chest is just tight because it's just it's shortened, I think, because I have these rolled shoulders. And so
Mhm.
I need to be more mindful in that stretching. So
Mhm.
how do you manipulate? How do you What does a typical appointment look like for your clients? Say who has something like tight shoulders or shoulder pain.
So, shoulder pain, I do a whole body assessment, which is fairly fast. And if somebody's coming for shoulder pain, I'll, definitely want to look at the spine and the, the ribs and make sure they're all moving, the clavicles are moving, and and then of course the muscles that are around the shoulder and the rotator cuff. But you're also looking at, the attachments through to the diaphragm and the lung and the pancreas and the kidneys and the neck. And so it's, you have to look at more than just the shoulder to determine where those fascial patterns are going to and what the culprit is. And but you definitely want to make sure that upper back, that spine is not compromised, for all the nerve roots and the neurovascular flow. And anyway, so it's you're not just looking at the shoulder at all. You're looking at much more than the shoulder.
Mm-hmm.
For that. But for every person that comes in, the assessment is, you do a whole body assessment. I mean, maybe not all at once, but as I like, also assess and treat often. But I do at least, 10 minutes of assessment at the beginning to have a sense of where I'm going.
And you probably might even not start right out with the shoulder. And have you ever done that where somebody will be like, oh, it's my shoulder, and you'll see something else. And then you kind of have to be like, well, wait a second, because this isn't in alignment, and then kind of work your way. Or is it always just focus on that, what they come in for?
I don't start with the shoulder.
Right. That's what I
generally would not
just
start with the shoulder. Okay. Now, some people come in and it's they're presenting with, let's say, a supraspinatus problem or tear or issue. And so that's a muscle. So if you need to give them tools to, you can work that muscle, but you need to give them tools at home to help that muscle recover, because one treatment's, not going to get them there. But generally, if they come for shoulder pain, I'm not looking at the shoulder to begin with at all.
Funny story. I have a friend who went to see a physical therapist because he was having some back pain. And the physical therapist told him to sit down, and he went down to his feet and started doing things, manipulating around his ankles and stuff. And my friend was like, I told you it was my back. Why are you at my feet? And I mean, he was but this was the mindset of our normal, typical person.
Mm-hmm.
I told you it's my back. Look at my back. I told you it's my arm. Look at my arm. But we often think we have all the answers. We go to somebody
Mm-hmm.
for help, but then we want to dictate
Mm-hmm.
what the person does. I had to laugh.
Exactly.
Anyway, the person who was working on his leg, I mean, and he worked his way up. He goes, it does feel better. I was like, there you go. It's good to
Mm-hmm.
listen to what the person who you paid to help you,
Mm-hmm.
listen to what they're telling you.
Now, sometimes people will come in and say they have a shoulder problem, and I will go to the shoulder at the end of the treatment, not because I'm doing anything that I think is good, only because I think they won't feel right about the treatment if I don't address the shoulder. Okay. But I'm only doing it because, not because I need to, but because
Expectations.
I think it will make expectations. Yes, absolutely. Yeah.
Mm-hmm.
Yeah.
Yeah. Interesting.
Are there any myths or I don't know, things that you want to clarify about osteopath and what they do, or if I was to book up an appointment with an osteopath, what should I look for when I'm booking an appointment? Is like credential wise, that kind of
So
thing.
that the credentials, of course, vary place to place. In Ontario, it is not regulated yet, so it's a little bit of buyer beware. So I'm a member of an association called, well, it's um, osteopathyontario.org, and it's the Ontario Association of Osteopathic Manual Practitioners. It's very long, but anyway, and insurance covers anybody who's a member of that association. But there are many associations out there in Ontario that aren't covered. So, but that differs country to country and province to province. So I can't really speak to, I can only speak about Ontario in that vein. But as far as myths, I mean, everybody, of course, thinks we deal with bones because osteo means bone, but that is, it's not, we deal with much more than bones, and it's a bit of a misnomer, which is too bad. But and the other thing is, it's very, for the most part, quite gentle, and a lot of people come in and or leave and think she didn't do a thing, like she just did nothing. I don't know
Did it
why I
for
just
nothing.
paid all that money. It was the, and then they'll call the next day and say, "Oh my God, I've been hit by a truck. I just feel, like so." And only as in, they're tired or they're because it's like any treatment. You might have a little soreness the next day as you would going to the gym. But I think people think the gentleness is that we're not really doing anything,
Yeah.
and it's not doing its job.
Hard is not always better, is what you're saying. You shouldn't have to feel the pain in order to feel better when you're going to
Well,
a
yeah,
practitioner, like in for some cases.
but having said that, I love chiropractic, I love massage, I love physio. I mean, I work with all the other um, therapists to because I think each of us comes to the table with a great skill set. And osteopathy is not the only. Uh, I mean, I'm often suggesting a patient go to another therapist at the same time to, get a whole, um, a different approach. And we all come at it a different way, but or health, we all come at health a different way, but everybody is important.
That's great that you all work together, because that was one of the
We
questions I
all
was
work
going to
together.
ask, that
Yeah.
that you're able to interweave and if it's something that's not in your scope or something that might be outside of your scope, you can kind of pass them on or forward them on to someone that it might be that area now that they have to focus on or whatever. So it's nice to know that it's not like a one size fits all for everybody, and there's different people for different things, I guess, right? Like once you get down and start unraveling what's going on, you get to a layer where you're like, oh, this is a little bit deeper than you know, I'll send you to physiotherapy or wherever, right? Like, so.
Absolutely, but I, it's not me. It's not osteopathy and nobody else. I mean, usually I
Right.
encourage people at the same time of going to osteopathy to. It depends on what's wrong with them as well, but to seek, for instance, concussions. There's some amazing work out there done by. It started out with chiropractic doing functional neurology with concussions. And although osteopathy does amazing work with concussions, but the treatment is best concurrent with the other. It's not that I would treat them and then I would send them. Sometimes it's good to have, everybody at the same time.
Beth, I
Or,
have a question. Sabrina and I talk a lot on our podcast about nutrition, mindfulness, exercise, movement. just as a way of a lifestyle, not that there's a one diet that fits all, but listening to your own body and understanding what your own body is telling you. With that being said, um, as far as nutrition goes, where do you how do you approach that with a potential client or a patient? And the other thing I have a question about is the role of calcium. Um, I grew up thinking that women in particular were really prone to osteopenia, osteoporosis, and that taking calcium was the end all be all and you wouldn't get it. I think that now it's been debunked. And what I understand now is that if you get too much, it actually is almost as bad as not having enough. And it actually deters the calcium absorption into the bones. How
Mhm.
do you how do you broach that subject with nutrition and that sort of thing?
So nutrition is not in our purview, so it is
Okay.
outside our scope. But I would send them out to, seek a nutritionist of some sort, a natural or a naturopath, a nutritionist, somebody who does have that in their scope. But having said that, I think it is hugely important, especially with all the research they're doing in the biome and the gut health and
Mhm.
um, um, and even water intake. And but I do not tell people to take a supplement or that they need, you know, to take anything by mouth. That is not in our scope. But I definitely would encourage them to go, seek another professional who does that because
Mhm.
it is important, very important.
Yeah. What about
And I agree
exercise
with the
routines?
calcium.
Is there things like yoga or Pilates that are more beneficial um,
I
to
love
the
yoga.
bone?
Uh, Um, I love yoga. I'm not sure, if you're talking about osteopenia and osteoporosis, I think, um, I think yoga is amazing, but I do think it's good to also do some, weights are amazing for the
Mhm.
body. There's science coming out about weightlifting and Parkinson's. And so I think weightlifting is great for the body. And, walking, there's a, a doctor at Dr. Michael Evans at St. Michael's Hospital has done a little um, video on the benefits of walking. And uh, so it is good to do weighted, exercises as well as yoga. I, but you can hurt yourself doing yoga. So you have to have a good teacher that is going to, and you have to not go beyond your ability,
Right.
I guess. So you can hurt yourself doing anything,
Well,
really.
it's like the hot yoga was like the big craze. I don't know if it's so much. I haven't heard many people doing it as much anymore, but around me. But I know that when I used to do it, I felt like that's how I would get injured because your muscles were so relaxed that you could go deeper than you actually probably should be. And some of the teachers would think that because you were in that class, you're maybe a little more advanced because oh, you should try it. You're totally ready to do that pose. But, you
Mhm.
know, in that situation and you're sweaty, you're falling, you're slipping, you're hurt, it wasn't always, it's not like you said, you have to listen to your body and do what you can. Don't
Mm.
look around. Don't let your ego get the best of you and be like,
Exactly.
I'm going to do the
Exactly.
headstand or the handstand because everybody
Mhm.
else is doing it. It's very important to just be mindful about where you're at and respect your body and what it can and can't do at that present time. So
Mhm.
I agree with you that I think yoga has its benefits, but it has to be utilized properly.
Right. And I do like hot yoga myself, but more for the sweating than
Mhm.
like I don't profess
Detoxing.
to be an advanced yoga person by any stretch of the imagination. But the sweat glands are that's the largest organ of detox that we have. So and we're all toxic. We live in a very, very toxic world.
Oh, indeed.
So I'm, I think everybody should sweat.
I love it.
Yeah.
Well, we're definitely sweating here right now in this, I don't know, in this season where we are. And whenever you listen to this podcast, it's July here in Ontario and Virginia, and it's humid and hot. And so we're
Yep.
definitely in our gardens and walking, getting some sweat on. So we're releasing
Mhm.
these toxins a little bit. So that's good.
Mhm.
Um, yeah, is there anything that's new and exciting or something that you're looking forward to learning more about?
Well, I myself am, I mean, there are many streams of postgraduate work that you can go down. You can go down the pediatric stream. You can, you know, there are many choices, and I am going down the biodynamic stream at the moment, and so I'm excited about learning that. It's more about working with the fluids of the body, and but also I think just in general, I think the research and they're about the importance of breath and taking and breathing properly, and its contribution to health is pretty exciting, and it's been around for a long time, but I think it's becoming more mainstream as far as you know workshops and availability for taking courses in breath work and yeah, yeah.
Yeah.
Of course, any kind of mitzvah and Alexandria technique. We don't have any of these up where we live, Sabrina, but in Toronto they do, and they're postural classes and it's not, you do very little tiny movements, but those are amazing. That's amazing therapy. It's not that an osteopath does it, but it's amazing
So
therapy.
what is the benefit of these small little movements?
Well, a lot of the postural muscles, a lot of the bigger muscles are not postural muscles. A lot of the postural muscles are smaller muscles along the back. So, just doing, um, you don't need to do gross movement to strengthen them, or
Hmm.
um, and and when you do gross movement, um, you I mean, as we age, we get into patterns of movement that are not necessarily right, like our gait.
Hmm.
Everybody, if you walk backwards, your gait changes, and you generally drop those bad habits
Hmm.
sometimes. But when you go to, if you're doing mitzvah or Alexandra method, or there are others as well, um, and you do the tiny movements, with somebody guiding you, you're less apt to engage muscles in a inappropriate or imbalanced way. Um,
Yeah.
lots of people engage their shoulder with the wrong, they're using the one muscle's weak, so another one's taken over,
Hmm.
and anyway, so you have less chance of doing that.
Yeah, I found that to be true when somebody has an injury and their gait changes because they sprained their ankle or stubbed their toe, and their gait changes a little bit. And then
Mhm.
even when things start to feel better, their gait sometimes still stays compromised. Like for some reason, it becomes more, it was acute, but now it's chronic, and now they're just chronically walking in this kind of
Mhm.
strange position. And I found it to be true in people in the with oral health because they had a tooth that hurt, or maybe it was fractured. And so they were chewing on the other side of their mouth, but now the tooth is fixed. But then for whatever reason, they're still chewing on the one side of their mouth, and they become a unilateral chewer instead of a bilateral chewer. And so they're not getting the digestion, they're not getting their food as emulsified as they need to, which then leads to more stomach upset and digestive issues. So
Sure.
yeah, it's
Yeah.
these things, sometimes these cute problems become a chronic issue because of habitual things.
Right. And muscle weakness happens very quickly. Like if you don't, use a muscle, um, and we, like, our world is imbalanced. We carry purses, and you know, we're on our phones, and we generally carry our children the same way and
Hmm.
cook with the same arm. Yeah, so we do everything in balance. So balance is important to the body, and heart. Those muscular patterns are hard to kick. It takes repetition for sure to
Yeah,
kick them.
right. Certainly have to pay attention to what you're doing.
Yes, yeah, and all those are good. Yoga, Pilates, they're all good for that for sure.
Hmm.
Yeah.
Thanks. So, if there's one piece of advice you wish everyone knew about their body, what would it be?
Gosh, I would say, you know, most people don't breathe properly, so breathing is a huge one. A lot of people, especially if somebody has pain, they become shallow breathers, and that, in the end, becomes a problem. So breathing is a huge one, and also just, this isn't in an osteopathic, an osteopath, or this isn't in my purview, but no, people don't drink enough water. I think water's terribly important. But gosh, uh, yeah, I'd say breathing and just mobility. A lot of people think, if they're in pain, I'll sit down and it gets me out of pain, but not that, some pain you shouldn't push through, but generally mobility breeds mobility. So, we need to keep moving somehow, or
Oh,
figure out
for
a
sure.
way to keep moving.
For sure.
We need movement for, digestion, and it just helps everything.
Yeah, there's that saying, if you don't use it, you'll lose it. And I
Mhm.
always say the bed and the recliner and the sofa is not your friend. You got to get off
Right.
of those things. You got to get moving. And
Yes.
so many times as people get older and they have those aches and pains, they just chalk it up to being old age. And that's not necessarily the case. So seeing someone, a practitioner such as you, Beth, would be an avenue they could explore to try and figure out what is it, why am I in pain, and what can I
Mhm.
do differently going forward so that I can
Mhm.
have a better life, live better longer. That's
Mhm.
my motto. I want to live better longer. I know I'm going to die, but I want to be as active as I possibly can for as long as I can. And there's a
Absolutely.
difference between living well and living long.
Mhm. I used to make my parents get, when they got into their late 80s and early 90s, get down on the floor and get up every day, twice a day, to be able to have that ability, because I just felt like once they lost that ability to get up, it changed things. Anyway, and they were able to do that until, you know,
Advice. My
you
mom is like that right now, and I wish I would have told her to do that because now when she falls, she can't get up, and my dad's weak, and trying to figure out what's wrong with him. And so then the other day
know.
she fell. He had to show her how to get up on his hands and knees and get up. And then as he was
Mhm.
trying to help her up, he almost fell. So,
Mhm.
it's this thing where you say, and she's that typical person that you would say, age. I'm getting old. What's the difference? It's okay. This is what happens. I'm like, no, mom, you're only 81. I know, but I'm old. I said, mom, but 80 is not old
Mhm.
anymore. You got, and she
Mhm.
went to a doctor and they said, like, with her, it's something with her nerves. But I said, mom, let's get you to physio. Let's at least try that, like get her out to move. They told her that it wouldn't help. And I was so disappointed that someone would say movement doesn't help because now in her head, she's like, oh, they said it wouldn't work. It doesn't
Is
help.
that
But
is that
any
the dog?
movement would help, right? Like his,
Wow.
she
Yeah.
didn't, yeah, because she can't walk and she can't. So I wish that, it's sometimes you just have to be that advocate for that movement to like
Mhm.
get strength and everything. So I do believe
Mhm.
you when you say like breath, movement, all these things are important. And when you're injured, sometimes, yes, you have to take a little bit of a step back, but it doesn't mean you can't still move doing something, right? Like at
Sure.
your pace or your where you're
Mm-hmm.
at. So,
Mm-hmm. Mm-hmm.
yeah,
Absolutely. Yeah.
yeah. It's been great. We've learned so much. I didn't really even, I always thought it was about a lot about bone. I didn't realize it wasn't. So when I reached out, you're like, well, it's not about bone. I was like, really? I was shocked myself.
Mhm.
So,
Yeah,
um,
no, it's
thank
not
you for
about bone.
clarifying that for us and telling us more about this
I think
wonderful.
the guy who founded osteopathy used to walk around with bones in his pockets, and he'd always have a bone in his pocket, and he'd be feeling the bone, so he knew that bone off by heart. And I think that's why they called it osteopathy. I don't know. Anyway, it's from the 1874.
Wow,
Like it's been around a long time.
long time.
Mhm. Wow. Well, Beth, thank you so much. It was so nice getting to know you and more about your practice and what osteopathy is really about because I'm with Sabrina, I had no idea.
Well, thank you for inviting me. This has been a great chat.
Been great. Stay cool and drink
I
lots of
will.
water today.
I'm on my herbal tea, which
Oh,
Or
good for you.
is
Good
your
for you.
herbal tea.
thank you.
Oh, nice. Good selection.